From 2010 to present day, the profession of occupational therapy has continued to change due to shifts in healthcare, technological advancements, global events, and many more factors. This era demonstrates occupational therapy's constant commitment to supporting an individual's independence and overall quality of life.
During this time period, there were many influential occupational therapists that shaped what OT is known as today. And one of those many influential figures is Amy Lamb, who is a former AOTA president, and under her, the AOTA board undertook a strategic planning effort to determine goals beyond the centennial year. These were focused on advocating for the importance of the association and promoting the distinct value of occupational therapy. These objectives were undertaken as part of the AOTA Board's Vision 2025 initiative, which stated occupational therapy maximizes health, well being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. Currently, she is an executive coach, consultant, activist, and post professional OT educator and mentor who has spent the last 2 decades studying systems and employing the strategies to drive change. And another influential figure who is currently the AOTA president is Arame Anvarizadeh. She was a professor of She was a professor at USC, and she led transformative efforts that resulted in the most diverse cohorts in the division's history, as well as preserving rigorous and effective admissions standards. She has been a driving force in advancing justice, equity, diversity, inclusion, anti racism, and anti oppression within the occupational therapy profession. Dr. Enverizadeh made history as the youngest and the first Black and Iranian woman to serve as vice president of the AOTA and to be inducted into the prestigious roster of fellows. She has made history again with her landslide election as AOTA president, a role she officially assumed in July of 2025. I would also like to acknowledge all the occupational therapists that continued their work and adapting to the pandemic, especially since it was very it took over the entire world in 2020. Especially those therapists that stayed working in the front lines and in those hospitals working with patients and risking their lives for that, as well as those therapists that learn how to use telehealth and really try to continue helping others through telehealth.
Vision 2025 was adopted in 2017 as the North Star for occupational therapy, helping guide the profession to the future. It built off of AOTA's previous centennial vision and is built on four main pillars. Firstly, being accessible, where OT provides client centered and customized services. Secondly, being collaborative. OT excels in working with clients and interprofessionally. Thirdly, being effective. OT is evidence based, client centered, and cost effective. And lastly, being leaders in healthcare. This profession is constantly changing in policies, environments, and systems. Today, Vision 2030 has been adopted as the new North Star to continue to guide this profession forward and shape the future of occupational therapy. COVID 19 was a global pandemic that significantly impacted occupational therapy, not only in the way they practiced, but in healthcare delivery overall. COVID caused disruptions in individuals' daily routines, work, school, and social participation due to public health, social distancing, and quarantine. Occupational therapists had to quickly adapt to be able to continue supporting clients and helping them maintain meaningful participation in their daily lives. They quickly shifted to telehealth and virtual healthcare services. During the pandemic, it highlighted occupational therapists and their importance in healthcare space, helping individuals manage stress, develop new routines, and regain function for those affected by long term side effects of COVID.
My name is Nanefia Murpho, and I'm going to be going over a few sociopolitical factors. In 2010, President Barack Obama worked with Congress to pass a healthcare reform bill known as Obamacare. And Obamacare actually allowed more people to be able to afford health insurance and the healthcare that they needed. This allowed them to have easier access to patient centered care which is pretty much what occupational therapy is all about. Occupational therapy is about patient centered care, giving patients individualized care based on their own goals and needs, focusing on the whole person. Another socio-political factor that I will be discussing today will be taking place in 2016 in the state of Hawaii. They became the 50th state to enact the licensure of OT practitioners. This allowed them to be able to work in their state, and it ensures that they are certified to practice occupational therapy. This also advocated for the AOTA, the American Occupational Therapy Association, allowing them to achieve regulation across all United States and globally.
Philosophical shift number one. Occupational therapy experiences a philosophical shift towards cost effective care and evidence based practices. Due to Obamacare from 2010, it helped funded research through the Patient Centered Outcomes Research Institution, which this was created in 2017. This supported occupational therapy to go towards client centered interventions rather than just treating symptoms. Government programs at this time wanted healthcare workers to prove that their treatments were needed. This led to hospitals being pressured to shorten patient stays, which later led to occupational therapists expanding beyond the hospital and going to home health settings along with outpatient clinics.
For occupational therapy from 2010 to the present, the profession expanded the use of technology, research, and telehealth to improve accessibility and patient outcomes. Occupational therapists began using virtual therapy sessions, mobile apps, adaptive equipment, and digital tools to better support patients in different environments. Telehealth became especially important during the COVID-19 pandemic because it allowed therapists to continue providing safe and effective care remotely. During this time, OT also became more evidence based, meaning therapists relied more on research to guide interventions and improve independence, participation, and overall quality of life for patients. These changes reflect OT's continued focus on adaptability, patient centered care, and meaningful participation in everyday life.